Welcome to our informative video about anthrax. In this video, we will explore the causes, symptoms, diagnosis, and treatment of this serious infectious disease. Anthrax is caused by the bacteria Bacillus anthracis. It can be transmitted through contact with spores in soil, animal products, and contaminated food sources. These sources of transmission make anthrax a significant concern for both humans and animals. Symptoms of anthrax infection include fever, chills, shortness of breath, and a skin rash. If left untreated, anthrax can lead to severe complications and even death. Diagnosing anthrax involves various tests such as skin testing, blood tests, and stool testing. These diagnostic methods help healthcare professionals accurately identify anthrax infections. The treatment options for anthrax include the use of antibiotics, antitoxins, and available vaccines. It's crucial to seek medical attention promptly to prevent the progression of the disease. In conclusion, anthrax is a serious infectious disease that requires awareness and prevention. By understanding its causes, symptoms, diagnosis, and treatment, we can work together to combat this threat. Thank you for watching and stay informed to protect yourself and others from anthrax.
Causes. Anthrax is a bacterial infection caused by the bacterium Bacillus anthracis. The bacterium primarily affects animals but can also infect humans. The spores of Bacillus anthracis can survive in the environment for long periods, and human infection typically occurs through contact with infected animals or their products. Contact with infected animals. Anthrax commonly affects herbivores such as cattle, sheep, and goats. Humans can contract anthrax through direct contact with infected animals or their products, such as wool, hides, or meat. Spores in the environment. Bacillus anthracis spores can persist in the soil for years. Humans can be exposed to these spores through activities such as handling contaminated soil or animal products. Inhalation. Although rare, inhalation anthrax can occur when individuals inhale airborne anthrax spores. This form of anthrax is more serious and can be fatal. Symptoms. The symptoms of anthrax depend on the route of exposure and can manifest in different forms. Cutaneous anthrax begins as a raised, itchy bump that develops into a painless ulcer with a black center. Swelling and regional lymph node enlargement may occur. Fever, malaise, and headache can accompany cutaneous anthrax. Gastrointestinal anthrax. Symptoms may include nausea, vomiting, abdominal pain, and diarrhea. Gastrointestinal anthrax can be severe and potentially fatal. Inhalation anthrax initially resembles a flu-like illness with fever, cough, and muscle aches. Progresses to severe respiratory distress and shock. Inhalation anthrax is often fatal if not treated promptly. Diagnosis. Diagnosing anthrax involves a combination of clinical evaluation, laboratory tests, and a history of potential exposure. Diagnostic methods include clinical evaluation, examining the characteristic symptoms and signs associated with anthrax, depending on the route of exposure. Laboratory tests. Blood cultures, identifying the bacteria in blood samples. Skin lesion swabs, testing samples from skin lesions. Imaging, chest X-rays or CT scans may be used in cases of inhalation anthrax to assess respiratory involvement. Treatment. The primary treatment for anthrax involves antimicrobial therapy, and in severe cases, supportive care may be necessary. Common treatment approaches include antibiotics, administering antibiotics such as ciprofloxacin, doxycycline, or penicillin to eliminate the bacteria. Treatment is most effective when started early. Inhalation anthrax treatment. Inhalation anthrax often requires aggressive treatment, including intravenous antibiotics and supportive care such as mechanical ventilation. Vaccination. In some cases, individuals at high risk of exposure, such as certain occupational groups, may receive the anthrax vaccine as a preventive measure. Prompt diagnosis and treatment are crucial for a positive outcome, especially in cases of inhalation anthrax, which can be rapidly progressive and fatal. Individuals with suspected anthrax exposure should seek medical attention immediately.